When the Heart Hero Elliott AED delivers a shock, it doesn't mean the emergency is over. The purpose of the shock is to interrupt the heart's abnormal electrical activity and give the heart the best chance to restart a normal rhythm. However, the heart may not begin pumping effectively straight away, which is why continuing care is so important. Immediately after a shock has been delivered, the Heart Hero AED will guide you with clear voice prompts. In most cases, the device will instruct rescuers to resume CPR immediately. This is because chest compressions help circulate oxygenated blood to the brain and other vital organs while the heart attempts to recover. Continue CPR exactly as instructed by the device. The Elliott AED will guide the rhythm of compressions and periodically pause to analyse the casualty's heart rhythm again. During this analysis phase, ensure no one is touching the casualty so the device can accurately assess the heart rhythm. The AED may advise another shock if it detects a shockable rhythm again. If this happens, follow the device prompts and ensure everyone stands clear while the shock is delivered. After the shock, the device will once again guide you to resume CPR. In some cases, the casualty may begin to show signs of recovery. This could include moving, opening their eyes, or beginning to breathe normally. If the patient begins to show signs of life, such as normal breathing, movement, or regaining consciousness, stop CPR and monitor the patient until the emergency services arrive. If the casualty remains unresponsive and not breathing normally, continue following the AED prompts and performing CPR until professional help arrives or you're physically unable to continue. After the resuscitation is complete, the device can be turned off by pressing and holding the green power button. After the device has been turned off following a rescue event, the green light will flash rapidly. This indicates the device is transferring treatment data from the event. Depending on the amount of treatment data and cellular connectivity, the light may flash for approximately 1 to 5 minutes. While the green light is rapidly flashing, the battery door should not be unscrewed or removed. Opening this battery door during this time can interrupt the transfer of the event data. Once the flashing stops, normal servicing of the device can be performed. Throughout the rescue, the Heart Hero Elliott AED continues to monitor the casualty's heart rhythm and guides the rescuer step by step. The device is designed to support the rescuer during this critical time, helping ensure that the right actions are taken while waiting for the emergency medical services to arrive. Remember, the shock delivered by an AED is only one part of the resuscitation process. Continuing CPR and following the device prompts are essential steps in giving the casualty the best possible chance of survival.